Master CVV Namaskarams to your lotus feet. నాలోన కలవెల్గునా పరిసరముల వారి రూపమున కన్పట్టుగాక నాయుచరించడి నాదమా వెల్గుగా వినిపించి కనిపించి వెలయుగాక నాలోన వెల్లుపల ఏలు నిశ్శబ్దంబు ప్రేమగా సాక్షాత్కరించుగాక మా కంఠ శబ్దాల చీకట్లు వెల్గుగా కరగించి అది మమ్ము కలుపుగాక తెలివికిని సద్గుణముల బలము గూర్చి నా ప్రణాళిక విశ్వ ప్రణాళిక గను వ్యాప్తమై విశ్వమూర్తి రూపంబునందు నిలుచుగావుత శాశ్వత నిలయమగుచు. Namaskaram, Master E.K. Good morning to everybody. In the previous class, we learnt about some useful drugs to treat the patient who are suffering with cholera. Today, we will proceed further and try to complete the rest of the useful drugs to treat the patients who are suffering with cholera. After that, we will start at the new topic, conjunctivitis. Now listen to me carefully. Helleborus. When cholera is advanced and the patient is about to die, the following peculiar symptoms indicate Helleborus, which will save the patient when applied carefully. They are when all the remedies discussed above do not result even when indicated, it may be necessary to use Helleborus. Conscious and unconscious states alternate. Eyes are half opened. In some patients, urine is suppressed. Red spots appear on white-coated tongue. When the above symptoms are present, 1 dose of Helleborus 200c should be given. Other homeopathic or allopathic medicines should never be given within 24 hours after administering Helleborus. If given, the patient will die. Care should be taken that Helleborus is not given between 4 p.m. and 8 p.m. It should be noted that 1 or 2 stools may result after giving Helleborus. We should neither repeat the dose, change the remedy, nor the treatment method. 4 or 5 doses of lecithin 3x shall be given as follow-up after 24 hours for every 3 hours. The next useful drug is Valander. Valander is a beautiful remedy to treat when the digestive system was involved. Digestion impaired. Digestive system is paralyzed. Food materials is excreted as it is. Patient excretes and urinates unknowingly. Loss of control of these two. Patient is depressed, forgetful, paralyzed state. Patient does not feel pain, intense pain in the lower abdomen, stabbing pain around the navel, motion of foul smell, nausea and fever. When these symptoms are present, Valander 6c will relieve. If the symptoms recur again, give second dose of Valander 6c. If the symptoms recurs again, treatment should be continued with Valander 30c. After that, 4 or 5 doses of NM3X should be given for every 3 hours. Medorinum. When the indicated remedy fails to relieve the symptoms of cholera and patient is at threat, 1 dose of Medorinum 30c shall be given. This will cure the patient and restore to health. Now we will start a new chapter, conjunctivitis. Eyes become red, swollen, watery, itch and burn. Copious, sticky mucus from cornea and inability to see light are the characteristics of conjunctivitis. Pupil affected by conjunctivitis suffer from these symptoms severely for the first 3 days and then recede over a period of 1 week. Pupil who do not have myasins are not affected by conjunctivitis. Many people are afraid that conjunctivitis is a contagious disease. According to homeopathic theory of Dr. Hahnemann, diseases spread from mind to mind and not body to body. Hence, when conjunctivitis is prevalent, if we spend time in the company of pious people, engage ourselves in service activity, serve the needy patients in particular and people in general, our mind will become pure and disease never infect us. People who have mental misbehavior cannot escape from being infected, how much serious their effort to be immune may be. It is better for people affected by conjunctivitis to practice the following. They are: eyes should not be rubbed. Soft, wet cloth should be used to wipe eyes. It is better to use distilled water to soak this cloth. It is advisable to use goggles. Easily digestible food substances should be taken. Fresh buttermilk and tender coconut water should be taken frequently. Fried foods, tubers, brinjal and Indian hemp plants should be avoided because these foods cause aggravation. Eyes should not be given strain. Watching TV and movies should be avoided. Should not roam under the hot sun. Eyes should be washed with cool water. It is also better to keep a wet cloth on eyes. According to Dr. Hahnemann, treatment is for the patient, not the disease. Hence, the following homeopathic remedies will be useful in treating patients suffering from conjunctivitis. Rustox, redness of eyes, watery eyes and nose, body pains, cold, sneezings, chills down the backbone, joint pains and restlessness indicate rustox. The patient moves continuously in bed, cannot lie down, cannot bear cold wind, feels as if there are sand particles in eyes and tends to rub the eyes in an attempt to remove the sand particles. Master Ike has been the first to give this dimension of rustox and he saved thousands of people from conjunctivitis. When these symptoms are present, along with the general symptoms of conjunctivitis, 1 dose of rustox 30C should be given. Once the severity of symptoms recedes, the next day onwards, we should give ferrum phos 6x as the follow-up twice daily to continue the treatment. If symptoms recede after using rustox 30C and aggravate again after few days, a second dose of rustox 30C should be given. If required, 1 or 2 doses of Rustox 200C can also be given. Thereafter, treatment should be continued using ferrum phos 6X as the follow-up twice a day for 1 week. The next useful drug is Epis. Redness of eyes, stings in eyes, piercing pains, inability to bear light, aggravation of symptoms by taking hot liquids or roaming on a sunny day indicate Epis. When these symptoms are present, Epis 6C should be given as the remedy twice daily for 3 days. If required, Epis 30C or 200C can also be given. When the severity of symptoms is reduced, ferrum phos 6X should be given twice daily for 1 week. Spizelia. Conjunctivitis affects left eye first. Eye becomes inflamed and has severe, sharp, stabbing pain in eyeballs, intense pressing pain as if the eyeball is pulled back into the orbit. Aggravation of this pain by turning the eyes, aggravation of pain in left temple when exposed to cold wind. The symptoms indicate spizelia. The patient cannot turn eyes without turning the whole body. When indicated, 1 dose of spizelia 30C should be given as the remedy. 1 or 2 doses of spizelia 30C can be repeated after 12 or 24 hours as per the needed. 1 dose of spizelia 200C can be given after 48 hours if it is required. Thereafter, treatment should be continued using ferrum phos 6X as the follow-up twice a day for 1 week. Sanguinaria. Sanguinaria is indicated when conjunctivitis attacks a right eye first and there is intense pain the right temple, severe pressive pain in the right eyeball, stabbing in eye, reddishness, watering and severe cold in right nostril. The characteristic feature is that pain in right temple starts at sunrise, reaches its peak at noon and gradually declines by sunset. When these symptoms are present, 1 dose of Sanguinaria 200C should be given as the remedy. After this dose, right temple pain and stabbing in the right eyeball declines and gradually symptoms of conjunctivitis recede. If required, 1 dose of Sanguinaria 200C can be repeated after 48 hours. Thereafter, treatment should be continued using ferrum phos 6X as the follow-up twice a day for 1 week. Euphrasia. Euphrasia is indicated when eyes become red and continuous secretion of thick mucus from conjunctiva which appears like curds. When indicated, Euphrasia 6C should be given twice daily for 3 days. Thereafter, Caliamur 6X should be given as follow-up twice a day for 1 week. Note, when this type of conjunctivitis infects, there is a possibility of permanent loss of vision if neglected. Pulsatilla, eyes become red. The patient feels to have cool drinks even though he has no thirst, but suffers from cough, cold and throat pain immediately after taking cool drinks. All symptoms aggravate during night. The patient cries out that others sympathize him. Symptoms are better by moving around in cool breeze. When the symptoms are present, Pulsatilla 6C should be given thrice a day for 3 days. Based on the necessity, Pulsatilla 30C or 200C can be given as the remedy. Once the severity recedes, natrum sulph 6X should be given as the follow-up twice a day for 1 week. Swasti.